Hi, this is Dr. Karen Becker, and today I am interviewing Dr. Margot Roman, who is a fellow integrative veterinarian and a friend of mine. This is part of the Highlighting the Healer series, which I started to highlight veterinarians that are doing really cool things in integrative medicine. I picked Dr. Roman because she does a lot of amazing things, but we're going to talk about hyperbaric and ozone therapies today. Dr. Roman owns and runs MASH Main Street Animal Services of Hopkinton, which is in the greater Boston area. MASH offers conventional and alternative therapies for pets, including classical homeopathy, acupuncture, herbal remedies, general medicine, and chiropractic care. Dr. Roman has also done over 10,000 ozone and hyperbaric treatments for a variety of different issues, which is what I'm going to interview her about today, because a lot of people don't know that these amazing modalities are out there, and Dr. Roman's been doing it for a very long time. So welcome, Dr. Roman, and thank you for joining me.
Thank you, Karen. It's a joy to be able to support you in this project because you're doing those things too as well, and it's really important information.
Well, you're doing some really neat things that other holistic vets aren't, like myself. So I'm so anxious to talk with you. Now, I've talked to you on the side about the neat way that you were introduced to this and how sometimes our life allows us to have opportunities that we would never ask for, but out of that comes some silver lining blessings. And so talk to me a little bit about, let's talk about ozone first.
Okay, ozone is one of the most amazing adjuncts that we can do for animals. It is adding oxygen to tissue and bringing in microcirculation to tissue. So if you can bring more oxygen into the body and more oxygen into an area that's inflamed, you can bring down inflammation. You can reduce cancer cells, because cancer doesn't like oxygen. Cancer really doesn't want to be in an oxygenated environment. So it's wonderful for infections, it's wonderful for swelling, for bruising, for trauma. And if you can use oxygen to kill bacteria, why would you use antibiotics? And especially with the use of with MRSA and with the overuse of antibiotics that we see now, that antibiotics don't work as well. So why not use something as simple and supportive as oxygenated fluids and ozone within those fluids to help curtail infection?
So how are you introduced to this? Because we've heard of ozone therapy. Of course, we know some practitioners that are doing it. I just know you that's doing it. So talk to me about, how were you first introduced to ozone therapy?
Well, actually, I had read about it in Marty Goldstein's book, and he had been using it. So he was really the first person who I had seen experience it. And then Dr. Tina Aiken had been saying to me, you should use ozone on your horse Champ, who was a horse that I rescued, who was 16, that was going to be euthanized. He ended up with getting cancer at 20. We treated him for 6 years, and then he needed another aspect of cancer care, which was the ozone therapy that we added onto. And Dr. Judah Shoemaker, who also uses ozone therapy, she added it to her. She's been using it in her practice. So I added it out of desperation because I had to figure out a way to save my own horse. And I learned so much from this horse. He was such a teacher, and things that I tried on him have given me an opportunity to help so many other animals. It's such an important piece of keeping somebody healthy, is to support the healthy tissue in a way that is very, very positive. And at the same time, with all the other adjunct things that we do with herbs and homeopathy and acupuncture and a bunch of other things that you do as well, nutrition, of course, is our centerfold of keeping the body strong. The ozone therapy has been such a positive adjunct.
So, as an example, with Champ, talk to me about how did you utilize ozone therapy with your own horse?
Well, at first I was afraid to give it any other way except rectally. And we use rectal ozone in animals, and small animals, a lot, and I thought, well, I'll do it on the horse. So I went to the barn with my ozone machine, and I have actually the ozone machine here, and I went to the barn and I carried, I took it there, and then I would fill up an IV bag with ozone gas, and then I put a catheter and I'd roll it up, and of course I'd hold it shut, and of course he just would fart it out, and I'd be like starting all over again, and I keep doing it over and over again. So then Judah Shoemaker said to me, Margot, you got to do it IV. I said, IV? I can't do it IV. I'll kill this horse. If I put gas into its vein, I'm going to kill this horse. So the first time I used it, I was really scared. I had him tied in a cross tie, thinking he was going to drop dead on the floor, and gave it to him. He didn't like it at all. He was very scared of it. And long story short, he had 116 intravenous treatments of ozone gas for 2.5 years. So it was amazing that this horse survived with that, and he survived with a cancer that was told that there was nothing he could do but be euthanized, and he lived 2.5 years. So it impressed me. It really impressed me, bringing down inflammation. After he'd get these injections, he'd be running around the paddock not directly after. Directly after, he'd be groggy for a few hours, and then the next day he'd be running around with like nothing, like he was not having any pain at all.
What was your interval of treatments then? Once a week?
I did 116 treatments over 2.5 years. So sometimes when he was more inflamed, I would do it biweekly. If he was doing well, I would do it once every 2 weeks sometimes when he was doing well.
And how far into that 2.5 years did you begin to relax about giving a gas IV?
Probably after about the 20th. I mean, the first time I prepped the whole neck and put a catheter, and I spent an hour and a half giving it to him. At the end, I basically just took a 25 and 1.5 inch needle and slapped it on with a piece of duct tape and gave it to him, and it became like not a 10 minute, but about a 20-minute application giving it to him versus an hour and a half. So it was very easy. But that was my first real introduction, was with the horse. And then I started giving it rectally to dogs, and then they developed this glass cylinder over here, which is on the side here, and that glass cylinder enabled us to bubble it through the saline and give it as a saline infusion. And anywhere that you use saline on an animal, you can use oxygenated fluids. So you can flush the mouth before a dental, and it gets rid of the whole biofilm of the mouth, and you don't need antibiotics. You can do the ears, you can do the eyes, you can do the prepuce, you can do the skin, you can soak a wound, you can give it as an enema to a obstructed cat, obstipated cat. You can flush the bladder with it, with an obstructed animal or a bladder stones. It is just such a, using saline is what we all do that in our practices. But to have that added piece of having oxygen and making it an antibacterial for anaerobic bacteria makes it such a perfect solution to use in all aspects of veterinary medicine, whether you're conventional or whether you're holistic like I am or integrative like I am.
So obviously infections, a great opportunity to use ozone. Gangrenous lesions, I'm assuming?
Yes, I mean I can give you some examples of those kind of lesions. My first real case that impressed me with ozone was a cat that was a client of mine, but it had been taken to Angel Memorial, which is where I did my internship, and I love Angel. And they basically said the only thing you could do for this was amputation. If you tried to save the leg, it was going to cost you, $4,000, and you'd probably have to amputate it anyway, so you might as well amputate it. And the owner didn't have the funds to do she wanted to save the leg. So she brought the cat, and she had to promise me that she would come every single day for ozone. So we put together as much as we could of this wound that was from a fan belt and was a degloving wound and was a really bad wound. And we put it together, did acupuncture, and then bagged the leg with ozone and used ozone fluids and cleaned it with ozone fluids and bagged it in the gas, and it healed in 1 week. And it blew me out of the water that it healed, and it had been on antibiotics, so I had kept it on the Clavamox that it was on, but I have since not used antibiotics for these kind of wounds and only used the ozone, and they've healed. The other case was my chicken, who I had pet chickens, and she got either attacked by some animal and literally had her crop and her esophagus were cut in half, and all the feathers in her back were pulled over her back and were just hanging in front of her. And I came home at midnight and saw her and asked my husband to come to the clinic and help me for 3 hours put her back together again. And since she was an organic chicken, I wasn't going to give her antibiotics, because that's what I raised. So we did her only with ozone, homeopathy, and acupuncture, and she completely healed and laid eggs till another 2.5 years, and then passed, 2.5 years later.
So you've had a number of cases that were just remarkable episodes of healing and really non-toxically, which is wonderful. Do you have a hard time convincing your clients, or do you find that people come to you so desperate that they're seeking these types of therapies?
Well, like I know, when people sometimes get to us, it's the 11th hour. They've been to the oncologist, they've been to the specialist, and they are frustrated with that there's no solutions. And often they're told that there's nothing they can do but euthanize an animal. And I get animals like that pretty much like several times a week that come into my, probably the same as you, is come into the practice. So when you have somebody who wants to try and has the vision of seeing more life in their animals and more time to spend with them, that's where they want to look for other ways of doing something. And it's very easy to say there's nothing you can do. When you give up as a veterinarian and you say there's nothing you can do and to euthanize, then you're 100% right, because you've just euthanized that animal and you've told them there's nothing else they can do. And in your heart, you feel like you did the best that you can do. But if you don't know that there's other ways of doing it, how do you make those choices to give that caretaker who wants more options, usually because they're coming to you for that reason?
So your clientele's been open to this. In fact, once people figure out that you're doing this, I bet you've had people show up specifically asking for ozone therapy.
Very much so. And there's a limited number of people that have ozone in the veterinary profession, as well as limited in the medical profession. It's actually being utilized in the American Dental Association. Now has a whole section on ozone therapy, so it's being used by the American Dental Association. And there are courses that teach dental ozone and medical ozone, and now there's a veterinary ozone course that is being offered, and the next one is going to be, in the spring. And it's wonderful. It's such a great course, and it's sponsored by the American Academy of Ozone Therapy, which their website is aaot.us, and you can get a lot of information if you're a veterinarian and you want to learn more about O3 therapy. It's great.
And let's talk about risks.
Mm-hmm.
Are there risks? What can go wrong? Do clients have anything to fear, or no? As long as it's done correctly.
Well, if it's done correctly, one of the things when you give the ozonated fluids, they're cold because you can't warm up your fluids. So if the animal is hypothermic, it becomes an issue. If the animal has a fever, it's actually really great because it cools them and gives them more oxygen. If the animal is slightly anemic, it actually helps their red cells work more efficiently because you're giving them more oxygen. If you have an animal that needs oxygen, giving it as an ozone, a gas with it's basically O3 and O2 together, you're giving oxygen to the tissue and to the whole body. So it's a positive supplement of oxygen to the body. And so, having complications anytime an animal can get I wouldn't call hyperoxygenated, but they can get too much fluid. If you give them too much of something of fluids, you can get hyperfluid therapy. And if we have an animal that has a cardiac issue, and ozone's really good for cardiac issues, is that we'll do it as a rectal gas and not as the saline. So we're getting higher levels of the ozone. We always complement it with antioxidants. So if the animal's on antioxidants, that's great. If they're not, we'll give them antioxidants after that.
And any situations where ozone would be contraindicated or not suggested?
If they have a very low platelet count, there's been some question on whether you should use ozone because it does slightly thin down the blood a little bit. I've used it on animals with low platelets, and I've had one issue where a dog was had cancer everywhere. He had osteosarcoma in the skin and all over everywhere, and everybody said there's nothing you could do for it, and we gave the ozone, and it caused a problem. The other one that you have to be very careful of, and this is the most negative, is that ozone is very irritating to the lungs, and it must be buffered with olive oil if you are going to inhale it. So if you have an animal that has a lung lesion, you've got to be very careful that the olive oil that you're bubbling is not dense. And what we do is we ozonate olive oil, and we use it as salves, and we can use it in the gums for the teeth and gingivitis and inflammation of the gums and wounds, and you can do it as a rectal suppository for colon cancer and colon polyps. But if the oil is getting dense and instead of bubbling like little teeny bubbles, it's that there's too much of the ozone that's not getting coated, and that can irritate the lungs. And the other one that I had was a terrible case was 2 FIP cats that were told there was nothing they could do, and the owner was supposed to be watching the cats getting the ozone, and she put a headset on and didn't pay attention, and the cats got too much of the ozone, and they really suffered from that.
So is this something that clients do at home?
No. They can buy an ozone machine, to give saline at home and buy the apparatus. And some of my clients have bought them and used them. One case in particular is a case of Olivia, who is this golden retriever who came to me. It's been about 5 months ago. It was a year that she came into my practice, and she was 14 years old and had a lung lesion already removed for cancer and had another one that was forming, and they basically gave her a few days to live. And she came in, and the dog was really having a hard time breathing, was a little pale, was struggling, and was bleeding out in the chest. And the owner was this very positive individual who said, I really want to try whatever I can. She is such a special dog. So we did the ozone on her, and we ended up taking her blood from her chest. And the other adjunct piece of this is I'm using ultraviolet blood therapy, where we take the blood from the animal, ozonate it, put in a solution called Biocean, which has all the trace minerals that come from the bottom of the ocean, and put that through ultraviolet light. And it kills all the viruses that don't like oxygen, and it also is like using laser on the blood itself. And so we put it through the ultraviolet light for 6 passes through it, and then we give it back to the animal. So in Olivia's case, we did it with her blood initially, and then when I tapped her chest, it was all blood in her chest from whatever cancer was bleeding in there. We never identified that again. They tried getting biopsies and they couldn't get them. But we ended up taking that blood, running that through the ultraviolet blood with the ozone, and giving it back to her IV. She lived 9 months more. And she was absolutely one of the most beautiful Goldens. And who knows, if we hadn't tried anything, she probably would have been gone in 2 days. I'm pretty sure about that.
So obviously infections, inflammatory responses, cancer. How about autoimmune disease?
Yes, because it's allowing the mitochondria to work efficiently. So when you give ozone, you're increasing oxygenation, but you're increasing it at the level of the mitochondria. So if, with biochemists explaining ozone, and they go through elaborate, evaluation of the Krebs cycle and where the NAD and NA, it goes to NADH. And so it's an increase of nitric oxide that happens within the Krebs cycle, which is what ozone is working on. And when I listen to biochemists, I completely understand it, but to go into it and explain it to you guys, I'm not I'm not going to go there. But it's amazing what something so simple as an extra oxygen molecule added to a cell can actually start this cascade of repair. And since 10% of our body weight is mitochondria, why aren't we feeding our mitochondria instead of shutting them down with drugs and putting more chemicals into them?
So that's a great overview for ozone. This is actually the first time we've covered ozone in Healthy Pets, so I appreciate that. That's going to give our readers, our listeners, just another option when they're looking for ways to be able to incorporate natural healing. That's awesome. Now let's move on to hyperbaric, and let's talk about how did you get involved? I mean, what was your experience? Did you read about it, hear about it?
Because I was doing ozone therapy and oxygen, I figured, why not get more oxygen? So the more oxygen we can do. So the big 1-2 punch is you do ozone, and then you put them in the hyperbaric oxygen. So you're getting the oxygen in the tissue, and then you put them in the hyperbaric chamber. So there are different types of chambers. I happen to have the soft-sided chamber, which is it doesn't get as highest percentage as the hard-sided chamber does, but I've had it for at least 10 years, and ours is the type of chamber that the owner goes in with the dog.
What's her treatment interval? How often does she come for her treatments?
She's been doing the hyperbaric about once a week, and she gets ozone and UVB once a week or twice a week, actually, sometimes. When she first came, we were doing the UVB and the ozone twice a week, and the hyperbaric once a week.
And so explain, for people that have never heard about hyperbaric therapy, just give us a 30-second overview on what the premise is.
Okay, the premise is that when you can increase oxygen levels in the body, you have more healing. Just why we do ozone too, is that if you can get a higher percentage of oxygen under tension in the body, when people have the bends and they go and they're diving and they come up and they have higher amounts of nitrogen in their blood, they're put in hyperbaric chambers, or if they've had carbon monoxide poisoning, they're put in hyperbaric chambers to force more oxygen into tissue. So the same thing for wounds, for cancer, for even for head trauma, for it goes across the blood-brain barrier, as does ozone. And so you can get into areas that drugs don't get into because oxygen can get into anywhere you have tissues. So getting a higher percentage of oxygen by putting it under pressure, you're getting the oxygen to go more and deeper into the tissue.
And any contraindications for hyperbaric therapy?
Yeah, I mean, some people can't go in the chamber because A, they're claustrophobic, or B, they have a nasal congestion because you have to decompress. You know, just like when you're diving, you have to be able to equalize your ears and your eustachians. So you really want to make sure whoever's going in there is not claustrophobic and has a sinus problem or something like that. Contraindication for the dog, usually you see them yawning because they're also decompressing, but just as much as if they go on a plane. You know, is it contraindicated, you know, for pressure? So it's that kind of, that's the concern.
Do you feel like that oxygen therapy as a modality is growing? Do you see more interest in your area? You think clients are catching on? People are calling you more interested, wanting to learn more? Do you see this as a growing modality?
I do. I think once people start hearing about it, they'll read an article and they'll call me. They'll go on the AAOT.us and they'll look for doctors in their area that do O3 therapy.
Well, this has been very enlightening. I appreciate what you do. I appreciate you being willing to share with us some great information about these two modalities.